it's where they said that we have Paleolithic minds, medieval institutions, and godlike technology, and we're trying to make sense of all of this, right? And so there's a lot that our Paleolithic minds are not used to, and I think a part of being in the moment, a part of meditating, a part of just being present and sort of tuning stuff like that out is better for your mental health and kind of makes you focus on things that are important. It makes you realize what is important too.
Hello, everyone, and welcome to Sounds of Health. This is the show where we uncover inspiring stories, meet incredible people, and share valuable resources to help you boost your physical, emotional, and financial well-being. I'm your host, Dave MacNiven, and today I'm excited to welcome our guest, Dr. Kunal Domakonda, a board-certified cardiologist and the owner of the Heart Wellness Group. Dr. Domakonda, welcome.
Thank you. Thank you for having me.
Did I get the name right?
Yes, that's correct.
I'm always
A lot of
nervous.
vowels in there.
There
Yeah.
is. Yeah, that's a tough one. But
It's like anaconda, but Domaconda.
oh, I
That's
should have
all.
asked you that beforehand.
Yes,
I
that's
would
right.
have probably remembered and not been so uncertain of myself in saying it.
That's fine. That's okay. No problem.
So we're excited to have you on the show today. Thank you for joining us virtually. I can't wait to learn all about the work that you're doing. I know we have a mutual friend, in Christina from Soleil.
Yep.
So we're really happy that she was able to connect us.
No, no, yeah, absolutely. And so, yeah, just to give you a little bit of a background, so I'm a cardiologist. I'm a board certified cardiologist in the New Haven area. We have several offices all over the New Haven area. But my background, I grew up I'm a Queens boy. So I grew up in Queens, New York. Went to school there and kind of traveled around really for my education. Went to New Jersey, went to Massachusetts for a while for my education, and I've become a board certified cardiologist. We also do so. There's all these other I also read something called echocardiograms and nuclear cardiology, nuclear medicine as well. That's where we do stress tests and stuff like that too. So um, I started my I was a cardiologist for the past about 10 years in the New Haven area, but 2.5 years ago I started my own practice, Heart Wellness Group, and we have 5 offices, all over Hamden, North Haven, West Haven, Wallingford, and New Haven City
That's
as
amazing.
well. Yeah, it's just great, and I was able to, the reason I got into cardiology, a large part of it, I think, part of it was probably from my, to be honest with you, probably my mom, kind of got me into because she had to deal with a lot of medical issues when she was, younger, and just kind of watching her, go to a doctor's office and waiting and being nervous and being anxious about,
Yeah.
with the information that she was told and kind of her path through her medical care kind of inspired me to sort of make sure that I treat my patients like their family and make sure that I understand that there's a lot of anxiety that's wrapped up involved in managing our health. Um,
Yeah. So being a doctor is something you wanted to do at a young age?
I was interested in science. I was always interested in, so it was either going to be, I was interested in neuroscience and I was a neuroscience major at NYU too. But the thing with neuroscience, it was great, but it wasn't the application. So there was a lot of science that was being done that was state of the art, but I was really interested in how we can sort of bridge the science with actually applying it to people. And that application of science was what really kind of interested me in medicine as well. Um, the reason I got into cardiology was after a rotation in medical school, I realized how obviously important cardiology is. And I think I like the sort of urgency of it and being able to sort of be there for patients when they need it the most and sort of kind of being able to sort of handle a crisis situation. So when someone, has a heart attack or has some sort of, heart failure or something, it's a much more it's a high, as you can imagine, it's a high intensity environment, and
Of
being
course.
able to being able to think clearly in that environment and dealing with people involved and there's kind of and sort of crisis manage that situation was kind of it intrigued me because it was very impactful thing that you can provide for patients too. So
So was that a big switch for you? Was that, you said that happened when you were in med school, kind of going from neuroscience into cardiology?
yes,
And
yeah. Right. So in medical school, we do rotations throughout. And
yeah,
so one of the rotations was cardiology. And so after I did a rotation there, and also cardiology and heart vascular, it's it's sometimes very simplistic too, because you can simplify the core principles of cardiology to to simple things too. I think that simplicity was kind of what kind of showed me the beauty of human physiology and stuff too. So that was a part of it as well.
now did that come with your family and friends always calling you anytime they feel like there's something wrong? Do you get a lot of that?
Part of it, yeah.
Yeah.
I'm actually, I get that a lot, and I don't mind. Actually, I really don't mind. I mean, knowledge for me, it's a matter of like I like to teach, I like to educate. I used to teach for Kaplan before, before college, after college, and before medical school, and so I really enjoy teaching. I really enjoy um, being curious. I enjoy people who are curious and ask questions and are like, oh yeah, why are we doing it this way? And I think I always encourage that. I think yeah, because I'm always learning too. I'm always trying to find out a better way to do things, or there's something some sort of insight that I can gain by thinking about some things differently. So I really encourage that.
That has to be important in the work you're doing too, because everybody is so different. So, I mean, it's
Right.
interesting. I'm sure there are treatments that kind of work for broad categories of people, but when it comes down to it, every person's experience and what they're going through is going to be a little different.
Yes, absolutely. And I think a part of it too is trying to apply the science and applying it to the person too. And that's kind of what I do every day. It's just knowing the facts and knowing what is the right quote unquote right thing to do based off of the evidence is one thing. It's a totally different thing when you're trying to apply it to someone and sort of incorporating that person's life and their own journey and trying to um, apply a scientific uh, thing, whether it be a new medication or whether it be trying to convince a patient to do a procedure. You sort of have to, yes, certain things, but you also have to then try to convince them and try to meet them where they are as well.
Yeah.
And in a non-judgmental way, you have to do that in a non-judgmental way, because everyone has a right to think about things differently. And you have to appreciate that and respect people and see people as as people rather than you know as a patient. To be honest with you.
Yeah, that's so important. It's something we talk about in our business too. I mean, that's one of my core values on our website. Something that we use as a guiding principle for us is knowing that every person is going to be different and to approach every situation with kind of that beginner's mindset. Like,
Right.
be interested in people. Don't be judgmental. Meet
Right.
them where they're at and see how you can help. So that's
Yeah.
great to hear you say, that's kind of your approach as well. Before we get to your actual business with the Heart Wellness Group, what led you into that being a business owner as well? And what brought you to Connecticut from Queens and those other areas that you said you spent some time in?
Right. Good question. I came here originally for work related reasons. I was a an employee at a cardiology practice before when I first arrived, and then I wanted to start my own. I always kind of wanted to start my own practice because that's really where you can practice medicine the way it's meant to be practiced and not be encumbered by sort of all the numbers and making sure that everything is done because um, uh, because of some higher MBA telling you that this is how it should be done. I think the more we go away from that personalized approach to medicine, I think patients suffer at the end of the day. And so I really wanted to make sure that I wanted to start a practice that kept the patient always at the center of everything that we do. And so um, every hire that we hire, every technology that we incorporate, we want to make sure that the physician or provider and patient interaction is not disrupted. And all of the things that we do kind of enhance that. So, for instance, whenever we see a patient, I like to make sure that I don't look at my screen. I think that's a one thing that patients always say, and even my own experience whenever I see a physician too. It's physician, well, you walk in, and then a physician's just staring at the computer screen and really not, interacting with you and treating you like a human being. And so I think, that was really on my mind. And so I make sure that we have the technology in place so that when a provider walks into the room and talks to a patient, they're just, talking to the patient. And yeah, we have a piece of paper where we are jotting down certain, points and stuff, and we can write down later. But when we are in the room with the patient, they are the focus of all of our attention.
That's really great. So the private practice and having your own business was the goal from the start. And it sounds like the guiding kind of factor there is that you wanted to control that patient experience.
Correct. Absolutely. And I was fortunate because, when I did start my own practice, a lot of my patients, were able to or wanted to sort of migrate with me. And so it was a lot. I was fortunate because, I wouldn't be able to do that without, my patients wanting to follow me too. And so
Of
I think
course.
and also that's just a testament to how you treat, people. Right? It's like that whole, it's like that the karmic cycle, right? Like do you want to others how you would on people want on to you. I'm messing it up, like the
Right.
golden
The
rule, I
golden
guess,
rule. Yeah,
right? The
of
golden
course.
rule, right? Exactly. And so I think that really does matter, and especially when, at least in medicine, there's a lot of practices that are being bought out by a larger institutions like hospitals. I think part of that is, yeah, you lose some of that when you become too big and you sort of
Yeah.
lose sight of why you're doing things. Um, yeah,
Well, that's great. I mean, there is a lot of consolidation in healthcare. We've seen that, especially in this state over the last few years. And getting back to that personal approach is so important. And I think it's such a missing piece in that overall kind of snapshot of a person's health and wellness is they need to be able to be heard, and they need people that are really approaching things in a genuine way.
right. And that also builds trust too. And that's the thing that I think physicians cannot overlook. Whether a patient ends up, following or taking your advice or not, at the end of the day, you have to maintain that trust. I think we are seeing a breakdown of trust in not just in medicine and healthcare, but in a lot of things. And I think part of that has to do with um, losing sight of the fact that human connection is the most important thing. And I think as long as that is there, it's then easier to build trust and to then, go from there really.
Yeah, I think that's a great point. Now, for you, you're in med school and you're getting all of this training to get the skills that you need to treat people. But do they teach you how to be a business owner as well? Like, how do what gives you that kind of background to say, yeah, I can open my own practice?
Yeah, I think no, they don't teach you a lot of the business skills. I think a part of that comes from, I guess, my curiosity. I've always, was always interested in doing something on my own and sort of you know, being able to sort of, control that aspects of healthcare. And so I was always interested in, I was always learning. I think that goes to I've always had, I was always curious about things. And so I would always ask questions. I was always trying to figure out how to do things. And there are ways to do it. I think that's what I tell even all my employees too. I mean, I tell them, you know, chase your dreams. And I think take a risk when you're younger too. It's a lot easier to take a risk when you're
Yeah, of
younger,
course.
but be mindful of it. But I think it's definitely possible. And I think, at least in this country, if I come from sort of like an immigrant mentality. My parents were immigrants, and there's definitely a sense that at least in this country, if you work hard and are doing the right things and are helping people out, it will come back to you, in multiple fold, in many times over. And so as long as you can follow that and have faith in that, I think I think it's possible for sure.
Yeah, I think that's great advice. I can remember when I was considering opening my own business and, get going away from that internal working for somebody else to having it all be on me. And it was exciting, but it was also scary. But, looking back, I'm like, I wish I had done it sooner. It was the best thing I've ever done. So, I think a lot of people do kind of, even people who have that entrepreneurial spirit when they're working for other people, sometimes they get stuck. They don't want to walk away from benefits. They have a family to support, things like that. But
Right.
it's, there is a lot of possibility out there. And I think you're right. It's, you're building that trust and you're building a clientele, even, wherever you are,
Mhm.
that pays dividends. It comes back to you.
Exactly.
So tell me a little bit more about your practice and what you do every day. How big is it? How many people do you have there?
Oh, so we have about 20 employees total. We go to different offices every day, and part of what we do is we do clinical cardiology too. So just talking to patients and figuring out their story and their history, and we also do something called echocardiography and ultrasound. So we do ultrasound of your heart, ultrasounds of like your thyroid arteries and your abdominal aorta, basically looking at the heart and the major blood vessels that come out in each direction. We do something called the nuclear cardiology, where we do those are called stress tests. If you've ever heard of a stress test
Yeah,
or
of
had a
course.
stress test, they're very
Yeah.
common. And so that is where we essentially inject a radioactive isotope that basically binds to your red blood cells, and we have a special camera that sort of images that bound pool of blood and we sort of monitor it going throughout your body and into the heart. And there's a certain pattern that you should see as it kind of goes into the heart, it kind of disperses evenly. And if it doesn't, then that could mean that there's like some shadowing and stuff. That could mean that there's some plaque buildup around the heart, some early signs of plaque buildup, and we try to catch those folks first, obviously, so then we can manage them, and before that becomes into something like a heart attack. And so we sort of try
Right.
to take care of it way before that ever happens. And then we also look at the electrical patterns of your heart with something called the Holter monitors and EKGs. And so the way I sort of tell folks is, imagine your heart is a house, and we are looking at different aspects of your house. Like we're with the ultrasound, we're looking at the doors and the windows of your house. With the monitors and the EKG, we're looking at the electricity of your house, of your heart, how it's beating. And with the stress test, we're looking at the plumbing of your house. And so
Yeah.
those are like the different sort of facets of looking at your heart.
That's really interesting. I never heard it described that way, but it
Mhm.
makes a whole lot of sense.
Yeah,
So there's a lot of aspects to heart health. There's different things that
correct.
can go wrong or that you can improve.
Yes, absolutely. I mean, right now, I mean, heart health and heart disease really, unfortunately, is still the leading cause of death in the United States too, and so it's very, very important. Um, a part of what we do is also preventative cardiology too. Is to Yes, obviously, we take care of folks after, we manage folks after heart attacks and stuff like that. But, preventing all that is the best option and was the best way to do it. And we do preventative approaches too. And I can give you one example where, we are starting to look at, not just, everyone knows about cholesterol panels and, making sure your cholesterol numbers are doing well, but we also do advanced lipid panels as well. And so those are markers that we are now realizing that we have missed in the past, which are also indicative of future heart disease too. And so trying to take care of all of that before and being aggressive early on is better in preventing heart disease, 10 years, 20 years down the line too.
That makes a lot of sense. It kind of brings up two questions on my mind. One, so the science of what you're doing is constantly changing and people are learning more as you go. Is that correct?
Yes, absolutely. I think in medicine, what's interesting about medicine too is there's a lot of things that are unknown, but there is a sort of evidence-based approach to trying to understand what is going on. Human body is complicated. Taking a single medication and how it on a cellular level interacts with different things, different organs, different systems, and it's a very complicated topic. And so, what we do in medicine is we do the evidence-based approach. Is there evidence to support what you are doing? By and then analyzing that information, analyzing that data is sort of how healthcare works. Um,
So you guys are learning something every day, basically.
Absolutely. We're learning everything. We're learning a lot of things every day. We're also learning to look at things differently too. And I think a part of being a good physician is being able to organize information as we have it now, but also being open to and sort of having the humility to know that we don't know everything and we are learning things and some of the guidelines might change, but also knowing what you do know. And so the way to approach it is there's a lot of evidence to support what we know now. But if there's new evidence to support other things, then we are also open to that as well.
Yeah. So not just stuck in your ways. You're kind of,
Yeah,
yeah, you're adapting
absolutely.
to what you're learning.
Right, exactly. And I think that's the approach that I tell my patients as well. And yes, we don't know everything, but this is the data that we have now. So, if, for instance, if I have a patient who's resistant of taking a cholesterol medication, for instance, I never sort of force it to them and say you gotta take this, but it's more like,
Right.
okay, well, this is the information that we have, and I'm here as an advisory role for you, and and really surprised. There's a lot of patients who initially or resistant, and then they're like, okay, well, it makes sense. And I think a part of that goes to just making sure that there's trust between the physician and the patient too. I think a lot at the core of it, it's it's all about trust too. And like, for instance, I'm not a car mechanic. I don't know a whole lot about fixing a car. And so I have to trust the car mechanic or find a trustable car mechanic
Yeah.
that
Right.
knows what they are doing. And at the end of it, it's really a matter of finding someone that you can trust, finding a professional that you can trust, and sort of going from there. But then also part of it is also checking up on it too, right? Asking the right questions, doing your homework, bringing questions in. And I encourage my patients always to, yes, do research and make sure it's a legitimate source of where you're getting information
Right. Of
from,
course.
right? Because on the internet, whatever you're believing, you can find someone or something to tell you that you're right.
Yeah.
And so it's not just more, I think oftentimes a lot of people think that having more information brings them closer to the truth. Not necessarily. Having more information does not necessarily mean you are closer to the truth. Having some sort of an organized structure of assessing the information may bring you closer to the truth. And I think a part of that is again this trust, trusting organizations, trusting experts to know what they're doing, and then checking up on them and making sure that they're right and stuff too. So
Right. Yeah, that's a great segue to what I was thinking about as my next question as well is, how do people know to find you and how are they coming to you? You had mentioned that you do help people with kind of preventive services as well,
right.
right? So is that, does someone need to have a history of heart disease in their family to even know to go see you?
Oftentimes, that's how it happens in terms of prevention. So a
Yeah.
lot of my patients really come from referral sources. So a lot of my patients come from primary care doctors who refer their patients over to us. But there are a few patients who come just going on our website, heartwellnessgroup.com, and we just kind of and there's like a contact form there. They make an appointment because they have family history that's significant with heart disease. So they might have a mother or a father or a sibling who's had a heart attack at the age of 55, and so it's a little bit concerning why they would have heart stuff at a young age, and so and part of our patients are concerned about that, and then they want to be checked out and making sure that they're doing okay.
So people can reach out to you and your group on their own. They don't necessarily need to be referred by their primary.
Yes, that's correct. They can reach out. Part of referrals has to do with your insurance,
Yeah,
to
of
be honest
course.
with you. And so if you're, but that's shouldn't be an issue, even if your insurance requires a referral from a primary care doctor. Our staff can look into that too for you. And so you can always reach out to us, and we can tell you, hey, listen, your primary care doctor needs to refer, but we can take care of that paperwork as well, and you can kind of get that paperwork and that referral from the
Yeah.
primary care doctor on
That's great
behalf
that
of
you
the
help with
patient.
that as well, because that is
Yes.
always a very confusing thing for people. We know we have a lot of clients who will sometimes struggle with that and call us and ask for advice.
Right, right. So yeah, what I tell them is, yeah, just call us, and our staff are trained to take care of that. And so if you need a referral, we can contact your primary care doctor and get the referral, and so that it'll be okay with insurance and stuff too.
That's great. Now, do you guys also offer any sort of education to people? I know you had mentioned that that's one of your things that you like to educate people on heart wellness as well.
Yeah, I know we do, and a part of it is we also team up with nutritionists in the local area, and this is something that we do on sort of a periodic basis. And essentially, it's for free, and it's really for our patients just to kind of get some information about their own heart health and just kind of whole wellness as well. And we sort of again we team up with nutritionists in the local area to do that and provide that information.
That's great. How much of the heart health has to do with your weight and making sure you're maintaining a healthy weight?
A decent amount, but again, it's hard to answer only because everyone is different
Of
too.
course, right.
Everyone is different, and just the weight may not be the only answer because it depends on your body mass index, and that is dependent really. It really does depend more on just weight as well, because you can also have someone who's, in terms of, weight, it might be completely normal weight or even underweight, and have this family history that's really significant for heart disease at a young age. And then you start to wonder, and then it could be their cholesterol too. And so weight doesn't always necessarily mean that they are in great shape either. And so there's a lot of genetic elements to it too. So if anything, it's 50-50. So some genetic, 50% genetics and 50% of lifestyle as well too.
So it's a mix of all of it.
Yeah,
Gotcha.
it
And how
is.
much are you seeing of the impact of these weight loss medications that are out there now? Do you talk to people about that a lot these days?
Oh, I do. And honestly, the weight loss medications, they started out as a cardiology medication. Those were in the cardiology world. And we were using them, for a few years before.
And what
And
were
so
they?
we
What
can
was the purpose there?
it was really meant more for folks with diabetes, and so it was really
Right.
meant to manage diabetes, really. And then as a side effect, they noticed that all these patients were, their hunger levels were a lot less, and so it was more of as a side effect of what we were already doing. And so then it was remarketed as a weight loss medication, but it didn't start out that way.
Gotcha. So I mean, that's something that's fairly new in the past few years, and you're hearing more and more about it every day. But that is a part of a tie into good cardiovascular health.
Yeah, absolutely. I think in the right patient, those are great medications. I think it's wonderful. I think they'll make cardiologist jobs a lot easier,
Yeah.
and make you live healthier and longer. And I think, and catching folks at a younger age is a game changer, and so that means that instead of, having high cholesterol since your 40s, you can kind of extend that out and make sure that the damage is not being done with things that are related to weight and with diet. I think that's a really big game changer. Really.
Yeah, that's great. So, what should people be looking out for when it comes to their heart health, and what are some of the things that really help to keep them healthy?
I think there are a bunch of things. I think one sort of simplistic way of looking at it is making sure, a sedentary lifestyle is a big deal. A lot of people, are sitting most of the time. Either they're sitting, they get up, they're driving, seated, going to work, or they work from home, mostly sitting. And they are at work, and they're mostly sitting at work too, and then they drive back or eating dinner.
Right.
They're
Yeah.
mostly so there's that set, so the in terms of sedentary lifestyle, it's a huge problem in this country. And I think understanding that is important. I think taking regular, just getting up, walking around. I think what we recommend is about 30 to 40 minutes 3 times a week of exercise. And by exercise, I have a lot of patients who say, "Oh yeah, I exercise all the time. I clean around the house all the time." That's great. That's good to do. But the type of exercise that cardiologists recommend is something that increases or elevates your heart rate and sustains it for at least a good 20 minutes. And so that's the type of exercise that is really good for your metabolism, for your heart health, and all of that. And what I would recommend too is, I mean, if you haven't exercised and you are starting to think about exercising, you could always, again, you could always talk to your doctor and make sure that it's safe for you to exercise if there's any concerns. And I would recommend, um, I'm anti a sedentary lifestyle, and so
Yeah.
doing anything to increase mobility, to move around is going to be a good thing.
Yeah. So even, spending some time standing instead of sitting when you're doing your work, or, making sure you're getting up and walking.
Right. It's going to help. Everything counts. So yes.
Yeah. Yeah. Something's better than nothing. That's what
Right.
everybody we've had on the podcast has said. It's just important to get started.
Yes, exactly. And sometimes it's hard, and stress definitely plays a role. Stress plays a role in everything, and especially and also in heart disease too. I mean, you think about it, if you're stressed out about certain things, it's you're not going to be thinking about exercising. You're not going to be thinking about, you just want to feel better. So you're not going to be thinking about making sure you're going to eat salad and making sure that you're going to eat healthy, and you just want to feel better. So it's easier to not stick to a diet. And so
Yeah.
stressors also play a role in all of this. And I think we can't deny that. Um, but exercise helps with that too. And sometimes, I tell people sometimes you can't wait to feel better. You have to do it and be consistent, and then you will feel better. So a lot of my patients, that's what I tell them. Like, you can't just wait to feel better. And then when I feel better, I'm going to start to exercise. I don't know if that always works. It's more do it and then wait to feel better. Then you will feel better eventually. And so sometimes you just have to do it and then you will feel better.
Yeah. I think that's great advice, especially when you feel stressed out about something, if
Mhm.
financial stress, emotional stress, like these are things
Right.
that I'm sure just impact all of us physically as well.
Sure.
So how much of that are you talking to people about in your practice as well? I mean, I would assume that is a big part of the conversation.
Yeah, a fair amount. And that's the stuff that you don't always get in medical school. How do you,
Yeah.
talk about that? So there's a lot of, and I talk about this on a daily basis for patients. And yeah, and I think, uh, like I said, I think part of it is just starting, and not, and, just putting it in your calendar. And this is when I'm going to start doing certain things. And then not waiting to feel better, but starting it, and then you will trust that you will feel better eventually.
Yeah,
If you're stressed out, I'm saying.
absolutely. For sure. So that's great. So I mean, it's good to know that the Heart Wellness Group is there for people. What are the locations you said again? You have a few offices.
Yes. So we have an office in Hamden, in North Haven, Wallingford, West Haven, and we're opening up a new office in New Haven as well, on 46 Quinn Street. But all of our
Fantastic.
locations can be found on our website, heartwellnessgroup.com.
That's a lot of growth in very little time.
Yeah.
yeah,
Yeah. We're busy,
yeah.
busy.
And you mentioned before we got on the podcast too. You have a child now. What, 6 months old? You said.
Yeah. 6 months and active and
Yeah.
moving around. So
So you have a lot
literally
going on.
I do.
That's fantastic. How do you find balance for yourself? How do you make sure that you have enough time to get to everything?
I think a part of it, I mean, my wife is a huge, help and a huge source of, happiness. And I think, for us, I like to think of of things to do that that don't cost any money. And those are small things. So, like for instance, we were playing. My wife made. We had all the boxes coming in from Amazon and whatever delivery services,
Yeah.
and so my wife made this thing out of one of the empty boxes, and she put like all these, made a hole, and she put like all the feathers in one of them, and so he plays with that, and so I think it's just finding joy in small things and just kind of enjoying life. Um, in the small things in the details, I think, and just being, and a part of that has to do with being in the moment. I think, cell phones, I think distractions like that are a huge barrier to that. I think cell phones they have a weird way of, they make you feel like you're busy, but then at the end of the day, you don't feel satisfied. There's no joy, from being on the cell phone all day and communicating
Yeah,
and
of
being
course.
on call essentially all the time. So I think no screen time, no cell phone, and so with our 6 month old, we are very strict about no screen time, so no television. And whenever we are interacting with him, I don't want him to be looking up and I'm staring at my cell phone, and he's trying to get my attention. And so, we really limit our cell phones. We put them away. We put them in one area where we really try not to do that. And I think that helps for that helps us to be in the moment,
Yeah.
and to really sort of
I
be there for
remembered
him.
when I was a kid, the best moments I had playing with my parents at that young age were with cardboard boxes. That's so interesting
Oh
that you
yeah,
brought
that's
that
right.
up.
Exactly. Yeah.
My dad took the big cardboard box. I can't remember what it was
Yeah.
from. Maybe it was a refrigerator
Right.
box or something. Cut it up and made a little puppet theater for
Yeah.
us. And we spent
Exactly.
hours with our little puppets making puppet shows. Like the
You're right.
littlest thing, becomes the most creative experience. It's so funny though. After that, my sister and I both go into theater and performance after that. But the smallest
Yeah.
thing at a
Oh,
young
interesting.
age, it
Yeah.
resonates further on.
Yeah. Absolutely. And I think because we were also watching certain shows for him as for a 6 month old, and I feel like when we turn the TV on, he just is staring. He's like a zombie.
Right.
Like,
Yeah.
in terms of he doesn't look at anything else. He's just focused on the television. And I feel like his receptors are so saturated that after watching television and after watching something so stimulating, everything else seems boring because and so that's why we really no screen time, and so no television, so that he can actually use his mind and use his imagination, as you were saying, and kind of taking something and making something out of it. And that's where human creativity is, and that's where our satisfaction is and our joy is too.
Yeah, I think you hit on a lot of important things there, especially when your kids are little. Being in the moment is so important. You don't want to miss out on that. And you get to see the world through their eyes, and it's just so much fun, and it's
Yeah.
important not to miss that. And,
Right.
as they get older, it gets harder to not spend
Yeah.
money and to keep them off their cell phones. We tried to keep cell phones away from our kids for as long as we could. I think we ended up breaking
Right.
down during COVID because that
Yeah.
socialization,
Yeah.
that connection was so important during those months.
Right.
But yeah,
Right.
that's
They can
that's
talk to
really
their grandparents. They can FaceTime with their
yeah,
grandparents. That's
right.
fine. That's fine. But yeah, outside of that,
Yeah, yeah, that's great. That's great. Well, it sounds like you have a lot going on, a lot of really great things that are happening for you. I don't want to take up too much more of your time. We really appreciate you taking the time out of your busy day to be here with us
Sure.
on Sounds of Health. The last thing we
My
usually
pleasure.
ask, I feel like you've already given us a lot of these tips. I think if people go back and re-listen to this episode, they're going to get a lot of really actionable advice. from this, and I appreciate that. But do you have anything else you can leave our audience with? Maybe something that you do in your life that helps you to stay healthier?
Yeah, well, and this is a cardiologist telling you this, but I think meditation helps a lot. And I think just being part of that, just being in the moment, and I think just allowing, because I think throughout the day, there's so many things that sort of race through our minds, whether on a conscious level or on a subconscious level. There's feelings, there's emotions, there's sights, sounds, right? There's memories, and there's thoughts and feelings about that as well. And so I think there's so much that we are kind of consuming, and we're online, we're interacting with other people. And so these are a lot of things that are coming to us. And I think one good quote, I'm going to botch the quote, but it's where they said that we have Paleolithic minds, medieval institutions, and godlike technology. And we're trying to make sense of all of this, right? And so there's a lot that our Paleolithic minds are not used to. And I think a part of being in the moment, a part of meditating, a part of just being present and sort of tuning stuff like that out is better for your mental health, and kind of makes you focus on things that are important. It makes you realize what is important too. Um,
I think that's great advice. I just tried to type out that quote because I'm going to search it
yeah,
up.
yeah,
That makes a lot of sense. It's important to find that time for yourself, that time when you can quiet everything, because information's coming at all of us so fast. That's great. Well, thank you so much again for being here on Sounds of Health and for joining us. We will definitely get some information out there about you and your group and what it is that you're doing. Thank you so much for doing that work. I know how important it is to all of us to maintain our cardiovascular health, and it's good to have a place where we can go for help, because it is something that I think many of us are challenged with at points in our lives.
yes. We're all just human, so
Yeah, that's right.
at the end
Yeah,
of the day.
God-like technology, but we are
Right,
human.
yes,
Right.
exactly. Right, right.
Great. Well, thank you again, and we appreciate you being here. And that's a wrap on another episode of Sounds of Health, brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. I'm your host, Dave MacNiven, and Sounds of Health is produced by Jason Carubia with music by Rob Hames. Every week, we bring you stories that inspire, empower, and help you to upgrade your health. If you enjoy the show, be sure to like, share, subscribe, leave us a review. We love hearing from our listeners, and we hope that you all continue as an important part of our wellness community. Thanks for listening.